Good afternoon. I am Melissa Toledo Ontiveros with Constellation Consulting, and we are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Tobacco Use Prevention and Control Program and will take place throughout May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at nmhealthequity.org. Due to the COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our Summit Planning Team, Presbyterian Healthcare Services, Con Alma Health Foundation, Be Well New Mexico, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or the Whova app. I also encourage you all to utilize this year's Summit on Health Equity event app. The Whova app provides you with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions you have or may have missed, download files provided by our presenters, and more. It's a great tool for you to use not only during the live sessions, but also throughout the month of May. Plus, when you use the app, you can earn points, which could mean prizes. Please check the leaderboard in Whova for more information. For our session today, attendees' webcams and microphones have been disabled. If you have any questions for today's presenters or panelists, please use the Q&A function within Whova, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenters will be posted as part of this session within the event app. If you need assistance during this session, please utilize the Q&A feature or the Ask the Organizers feature in Whova. You may also try emailing us directly at info@constellationnm.com. Following today's session, we appreciate if you take a few minutes to complete our session feedback by clicking Rate in this session of the Whova app. If you'd like to request community health worker, social worker CEUs, or continuing medical education units, please include your name and email address on your evaluation, and CEU certificates will be emailed within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. Finally, before we begin today, Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting Black, Asian, and Pacific Islander communities, with whom we stand in solidarity. We are New Mexico, and we are built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage each of you to seek out, learn more, become involved with, and support organizations who are building a better New Mexico for us all. So today we're excited to welcome our panelists for today's session. Derek Lynn, Research and Policy Analysis at New Mexico Voices for Children. Marshall Martinez, Executive Director of Equality New Mexico, and Dr. Jennifer Gomez Chavez, Special Assistant to the Associate Vice Chancellor in the Office of Diversity, Equity, and Inclusion at the University of New Mexico's Health Sciences Center. You can read all of our presenters' complete bios in our event app and on our website at nmhealthequity.org. As a reminder, if you have any questions for our panel, please submit your questions through the session Q&A tab in Whova, and we will address as many questions as we can during the time allotted. Please welcome our panelists. So Before we begin, I'm just going to say public health policy. So we're going to talk about public health policy. And what is that? Public health policy approaches have demonstrated measurable improvements in population health, yet one size fits all approaches do not necessarily impact all populations equally. And in some cases can widen existing disparities. It has been argued that interventions, including policy interventions, can have the greatest impact when they target social determinants of health. Today, our panelists will talk about equitable policy processes and approaches that can be applied to advance health equity. So one of my favorite parts of meeting somebody is hearing their story, right? So we're going to begin with hearing the story of each of our panelists, and more specifically, what influenced our panelists to get involved in the work that they're doing today. And so each of our panelists will take a minute or two to share why and how they got involved in the policy process and what equity means to them. So Jennifer, do you want to begin?
Yes, thank you so much, Melissa. I want to thank you, Suzanne, and the Department of Health for inviting us for such an important conversation, because, you know, when we hear policy, there are many individuals that feel very intimidated and feel like they don't belong or they can't be a part of policy development. And so my story is that I actually got involved both professionally and personally. Professionally, working with the university, 27 years in education, we were always asked to advocate or to review policies to ensure that our students and their families, right, that policies represented them in an equitable manner. And then personally, I was diagnosed with multiple sclerosis in 1995, de-diagnosed in 2000, and received my final diagnosis in 2008. And because it impacted me so personally, I was devastated. So, you know, I thought my life was going to end. I thought MS was a death sentence, but with some wonderful mentors, I was able to take my negative situation and fully get involved in the National MS Society and in policy and advocacy. And, you know, as you ask, what does equity mean? Well, it means that we want fairness and we want to meet people where they're at and provide resources and services and support to get people where they're at to where everybody else is at. So thank you.
Marshall, would you like to go next, and then Derek?
Absolutely. Thanks so much, Melissa. And thank you all again for having us here. My name is Marshall Martinez. I use he, him pronouns, and I'm the Executive Director of Equality New Mexico. We're a statewide LGBTQ advocacy and civil rights organization that's 28 years old. My start in this work a very long time ago was through a loose connection to Equality New Mexico when I was in high school. I was born and raised in Alamogordo, New Mexico, a relatively conservative, relatively rural community. I was in high school in a time when people were still dying of HIV and AIDS. And I became a sex educator, a peer educator. I was teaching my peers how to have safe and healthy consensual sex. And I was suspended from my high school for giving out condoms to students on campus. And, you know, I think, you know, as we talk about developing equitable policy and about the ways that people enter this space, for me, it was about fighting back against a policy that was inherently inequitable and harmful. As an openly queer, then gay man, identifying as an openly gay man in high school, in a time when gay and bisexual men were dying of a virus they could protect themselves from, the policy said that I couldn't provide my peers with that protection, right? And so Equality New Mexico then had a different name, but was doing the same work. It was a part of a statewide network that was really working on policies around young people, sex ed, HIV and AIDS prevention. And so that's what brought me to this world of what I now know is policy work. but at the time was just one of the many ways that as a precarious young person, I was shaking things up, in my small town. And so, yeah, that's how I got started in this work. And I'm really excited to be back at Equality New Mexico doing it. And spoiler alert, we still haven't fixed sex education for young people in New Mexico. So my first fight is the one I've been fighting consistently for a number of years that I would like to not admit publicly.
Thank you. Thanks. And Derek?
Hello, everyone. Appreciate being here. My name is Derek Lynn. I use he, him pronouns, and I'm with New Mexico Voice for Children as a research and policy analyst. And my path here has been kind of circuitous. I didn't expect to find myself in policy, kind of like Marshall said. And just 2 years ago, I was actually working in a biomedical research lab, and the work I was doing there was all focused on the Western diet and all of the harmful health outcomes that come from having Western diet. And, as I started to ask more questions about the Western diet and, look deeper into the socioeconomic factors that contributed to people who consume food that is unhealthy for them, I found myself arriving at a place of systems instead of behavior, looking at, what are the systemic factors that are perpetuating these unhealthy diets in our communities of colors, especially our communities of color and our low-income communities. And so that kind of that line of questioning led me to do a master in public health at UNM, and then through my mentor I I started to get into some policy work. And fortunately I ended up at New Mexico Voices, where I have kind of learned on the job how to think about systems and think about using policy to change those systems to become more equitable. And so, I also like that Dr. Gomez Chavez mentioned the personal and professional side of things, because on the personal side for me, being the son of a Chinese immigrant and a person of color, I've always felt, I felt the currents of inequity, but I haven't really understood them. I hadn't really understood them for a long time. And so, my journey in better understanding equity has kind of, awoken me to those currents a little bit more and helped me better understand the purpose for why I'm here and what I want to do, and the cause that I want to fight for. And so it's kind of a multifactorial journey for me that led me here. But this idea of what equity means to me, I think Melissa actually used the phrase that comes to mind. It's the one size fits all approach doesn't work, right? And that's kind of what equity takes into account, is that there are racial, ethnic, cultural, environmental factors that all shape what people need to be healthy, and you need to consider those if you want to make sure that you are delivering public health in a constructive way. So that's kind of how I've arrived here and where my head's at, so to speak.
Wow. Thank you. Thank you guys for sharing your stories, and thank you for your bravery and your advocacy on these very important issues. So let's go into talking about our legislature. We all know that we have a very unique legislature, and with many, many strengths. Do you guys want to kind of go round robin and talk about that a little bit? And
I'll go ahead and jump in. Thanks so much, Melissa. And I think both Derek and Dr. Gomez Chavez probably have lots to add to this. I will say, in my work, in advocacy work with multiple organizations, many of which are nationwide, New Mexico's legislature is super unique in that we have so much access to our legislators. And you know, I remember when I worked at Planned Parenthood and I was talking to my peer in another state, and they talked about scheduling an appointment with their legislator and having to work 3 months in advance. And I sort of flippantly said, like, oh, just walk into their office like we do, or wait until you bump into them at the grocery store like we do, right? And I think that the citizen legislature in New Mexico, and just the way that it is set up, with so many drawbacks, and I want to be clear that there are lots of drawbacks to having an all citizen unpaid legislature, but the access that we have means that so many of us have an opportunity to influence policy, right? We have I as somebody who didn't graduate from college, as a high school student, and then early on college student, was having conversations about sex education with legislators, and it didn't require lobbyist registration, a specific level of education, like an entry point. Nobody had to physically open that door for me to have that conversation. And so when I think about the uniqueness of our legislature, that's the first thing that comes to mind.
So I want to just jump in here, and I agree, Marshall, thank you so much for just that wonderful overview. And, I too have seen, because I do policy work and advocacy work at the national level with the National MS Society, and we often have our policy summits. And it amazes me when we talk about our experiences in regards to our state and congressional leaders. I feel like we have those deep relationships. And so, and what's, I'm not sure if this is unfortunate or fortunate, but, because our legislators are not paid, we don't see enough equitable voices. So I do want to bring up, right, that even though we have this wonderful access, yet we're not seeing the younger voices. But we are seeing more women, right? I feel like more women now are being represented, and women of color are being represented. So I wanted to include that as well.
Yeah, and I'd echo what both Marshall and Dr. Gomez-Chavez have said. The accessibility is very unique here. I have a coworker who used to advocate in the California legislature, and he said that the legislators there have upwards of in the hundreds of thousands of constituents, whereas some legislators here have in the tens of thousands. And so that that magnitude of difference is huge for accessibility. You do have unprecedented access to a lot of the legislators in our state. And they're for the most part pretty receptive. They are pretty receptive to their constituents reaching out to them and voicing their concerns, and that's incredible. But as Dr. Gomez-Chavez mentioned, one of the downsides of our legislature is that it is a citizen legislature, and that does select for people who have money to afford to spend 1 or 2 months out of their year working and doing lawmaking and policymaking. And so, because of that fact, you do exclude a lot of New Mexican voices from being able to participate as policymakers. But yeah, I think there's pros and cons to it. And, I think that I know that there are some efforts to try and make our legislature a paid legislature, which I think would be huge for equity in our state.
Thank you. Thank all of you for your answers and your comments. And so, Jennifer, I know when we met, we talked about intersectionality. Can you talk more about that and how we can use that to strengthen health equity for all New Mexicans?
Well, again, I think this is an example, right here, where we represent different identities that we belong to. You know, I talk often that, you know, now I'm seen not just as a Mexican American, you know, a person who's in education, but I also am seen as a person living with a disability. So I think with our different own intersectionalities, as well as working with others, that provides us with different lenses, which we can speak to those inequities. And that's why it's important, right, to get people involved in the process, because everybody's experience is different and it is of much value. So, you know, I think it's critical, and we just can't say we're this or we only work with this population, right? Because every day we are working deeply with, you know, in intersections, with community members, with our own challenges, and which leads to us to be able to provide voices and provide, you know, the knowledge that is needed to develop equitable policies.
Thank you. I should have kept that for the advocacy part, right? So let's like kind of slip into that. You know, advocacy at all levels is important, right? In developing and implementing equitable policy. And Derek, you said it. You said this. Organizations and communities need to make sure that policy is equitable throughout the policy process. So how do we assure that everyone who should be at the table is at the table? And you guys, I'll let you just jump in there.
Yeah, I mean, you know, great question. And I think I mean, I think it's a practice. I don't think that there's perfection when it comes to bringing everyone to the table. I don't think I've ever been at a table where everyone who should have been there was there. And as hard as we try, you know, I think there's always some room for improvement. I think that that's kind of implicit in this whole process is having that humility and recognizing where your shortcomings were, who wasn't at the table, and trying to do better next time. And you know, that's kind of where this like intersectionality comes in, and you know, these groups come in, that we can rely on each other to then speak out in those circles and say, hey, we need to make sure that Marshall is here. We need to make sure that Dr. Gomez Chavez is here, and so we can you know, we can leverage the relationships that we have with each other to help make sure that we bring everyone into the conversation that should be there. But you know, I think you know, I think it's that's one of the great challenges. You know, I think because of intersectionality, no two people have the same exact identities, and so you know, the intersections of identities that I hold are going to be different from another person of, you know, Chinese immigrant descent, and so it's hard to fully cover everything. And yeah, I mean, that's where I think you know, we need to understand that this is a practice, and we're all trying to refine it as we go, and improve it, and be more inclusive in these different iterations of these tables that we put together.
Does anyone want to answer that? Or I think Derek.
I think Derek said it all.
Yeah.
I just want to I want to just sort of lift up, like, it is a practice, right? And I think that oftentimes I've seen folks get stuck in trying so hard to make sure that they're doing it perfectly that they don't accomplish anything, because they're sort of in that nervous or anxious over processing phase, right? And I represent Equality New Mexico at a lot of different coalitions and a lot of different tables. And I feel like in every space, I ask myself 3 questions: who's not here, who's not speaking, and who's not being heard. And it doesn't necessarily, although sometimes you got to stop the meeting and say, we can't go any further without these voices, right? But sometimes it just means sort of tracking that to your, asking the questions to yourself and tracking that, and then just show up with an extra +1 to the next party, and and be like, it occurred to me that Derek wasn't invited to this meeting last time, and he's got a lot of really great input to offer on this topic, so I just brought him along, and so continuing that practice. But for me, it's those 3 questions are so critical, right? Who's not here, who's not speaking, and who's not being heard.
Well, and I want to jump in here because as you both speak, Derek and Marshall, it reminds me of, every year at the legislature, I mean, we have interim committees before we get to the legislature. But I think about, many people who are working who cannot be at the legislature. So this last year, because of the pandemic, I felt that there were a little bit more access to very other individuals that might have not been able to, drive to Santa Fe. And so, we need to look at that now. Did it in fact open more access to the different voices that were missing prior? So I'm just reflecting as I'm hearing you talk, can we use this last year as a way to, to reevaluate and inform the legislature to possibly, I know they have the webcasts, but I know a lot of policy development also, was done via Zooms. And then coming to testify, we were able to include more voices.
Thank you. So I have a question. Does forming a diverse group always mean that you'll have equitable policy? You guys just take it as is. We can just keep this open like we did. And
so y'all want me to go ahead and get started, because I think that we discussed this, and I think it's kind of like asking, if you've gone through undoing racism, does that mean that you're no longer going to be a racist, right? And so the answer to your question, Melissa, is no. I think that not everybody understands equity and what it means. And so the more we lift that up, the more we discuss it, the more we model it, the more, we're intentional about it, I think the more people will truly understand. But it does not mean that everybody understands it, and that, just because you have a diverse group, right? They understand it, or their mindset is going to help develop equitable policies. I mean, that's just, we hoped, living in New Mexico, we're one of the most diverse states, being around it every day. We always hear the major challenges, the gaps that we're faced with. But unfortunately, not everybody, and I think it goes back to our stories. I think if you don't sometimes understand it personally, then you see it through a different lens. And so, I look at Marshall and Derek, who work, hand in hand with the community. And then you do have some other individuals who aren't doing that, have a different perspective.
Yeah, I would love to. Thank you, Dr. Gomez Chavez. I think that is so right. the diversity for the sake of checking the boxes does not accomplish equity, right? Something that the metaphor or the comparison that I'm very fond of making is also asking, at what point do you form the divorce group and what role do you give them, right? And I think I've said this in other spaces before of don't plan the party, pick the theme, order the food, create the guest list, and then ask to put my name on the invitation as a co-host. I'm not a co-host of your party, I'm just showing up to it, right? And so if you want to create equitable policy, don't draft the policy and come up with this solution that you've identified on your own, and then try to get a bunch of queer and brown and Black folks together to sign off on your policy and then say y'all, we got equitable policy. That's maybe it's equitable, but you probably didn't do that by yourself. You probably didn't accomplish that. And certainly, don't put our names on something that we didn't draft, that we didn't write, that didn't get filtered through our communities, right? And so I'm sure all of us have been in that space. I couldn't count the number of times that somebody contacted me, and I've been out for a very long time. It contacted me and said, we identified this problem and we came up with this solution, and we just want you to make sure it's going to be okay for LGBTQ folks. Could you just put your stamp of approval on it? And the answer is and should be no, right? But when you're ready to rip that up, get a brand new blank piece of paper, I will happily sit down with you and draft from scratch.
Absolutely. I mean, eloquently said, Marshall. Yeah, that's a huge issue in policy development, is this ivory tower thing that is historically been how policy has been developed, where it's prescriptive, it comes on down from up high, from the powers that be, whoever they are. And the design and the development process isn't driven by the communities who are most affected. And that is the piece that that Marshall was describing, that I agree with, is so necessary for equitable policy development. It has to come from the voices of the people who are most impacted. And this checking the boxes of diversity is not sufficient for that. That doesn't inherently make something equitable. And it does have to do with where the power lies and where the decision making lies. And I think that there's a lot of work that needs to be done in that specifically. And at Voices, that's what we're really trying to become better at, is that specifically using our connections in the community to drive how we develop and recommend different policy interventions. I think equity is the guiding star of all of this. It's an ideal, but it's not an endpoint. And I think that even when you do everything right, you can come up with a policy that still has unintended consequences and still creates inequities. And so that's when you do go back to the drawing board and you do consult with those community partners, and you do have a discussion about what you could improve next time around. And so yeah, I mean, it's so much of it is about that practice that Marshall mentioned.
Great discussion. Wow, thank you guys. So I love the analogy of the party. Not everybody is a cake maker. Not everybody can create, the list of who's going to be at the party. So what are the different levels of advocacy? And with that said, how does one get involved?
So I'll take this. I'll start. I think that, some individuals feel, and I think we've talked about this, you hear policy, you hear legislators, and some people feel intimidated that they don't belong in those spaces or places, that their voice doesn't matter. I don't know how many times somebody's like, I'm just little old me, or I'm not really, in a position of power, so my voice doesn't matter. There's no way that I can be that what I do is meaningful. And other individuals are worried to get involved, to be out there vocally, because they fear retaliation. So one of the inequities is that we keep telling people get involved, but in fact, some of these organizations and institutions want you to be true or loyal to those institutions, rather true to the issues and to the community, the needs of the community. So there's different levels of involvement. You can be, behind the scenes, right? Making phone calls, doing emails. That is a part of policy development. Giving ideas. You can come to meetings. You do not need to be the person always out there advocating like Derek, Marshall, and myself, because we feel comfortable, right? Where we have different, our entities allow that, but other people don't feel like they are comfortable to be in those, in those different levels. So I would say, you can be part of the idea, you can be part of the writing, you can be part of advocacy, emails, phones, or you can be right up front testifying. So I think that there is different levels for people to be involved, and we, it's important for people to understand from the time we wake up in the morning, every day, everything that we do every day, to the time that we die, and the way we die and how we're buried is all driven by policy. It impacts us every day. So there are so many different issues that people can get involved in.
Yeah, I would echo what Dr. Gomez Chavez said 100%, right? There are so many different levels and ways. Finding organizations like Voices and Equality New Mexico that carry the voices of community folks sort of anonymously into the building, so to speak, into the legislature, right? And so definitely ways to not be as upfront. Because I have a feeling that folks who are drawn to this conversation are already involved. One thing that I think is the next step for those of us who are involved in policy development is bring somebody with you who's never been there. It can be hard for me in a peer group of mostly gay men who spend our times at bars and watching Drag Race. It's hard to convince them to come to the legislature with me, but every session when I go, I try to convince a couple of new people, like, just come, hang out, you don't have to talk to anybody, follow me around, sit in this room and watch how this happens. Just demystifying the process, but also actually physically opening that door for other people, right? And making space for them without the risk or the commitment of, I want you to come and tell your personal story to this group of 15 people that are total strangers. It's great if folks want to testify. It's great if folks want to speak at a city council meeting. It's also great if they just want to go sit and watch and learn and listen and debrief with you later. And probably will come back in their own time at a different level, right? But I really think physically bringing people into the space is the step that many of us who do policy development at this level forget, right? That is the next step. Making sure that we include other experts in that space really means opening that door for folks.
Yeah, I really like that word demystify, because, before I started doing this, it was just a black box of like, I don't know what's going on in the roundhouse, and it's intimidating, and these people have power. And, I had some friends who brought me in and who were able to show me the ropes and demystify it for me. And that helped a lot. And, from working at Voices, we are a research and data organization for the most part. We will, use data to create reports and go into the legislature and and advocate using data. But ultimately, stories are what compel people. That the human stories that people can share, that's way more compelling than any data will ever be. It's relatable. It tugs at the heartstrings. It's emotional, and that's more real to people. And so, whether you are writing an op-ed, writing a letter to your legislator, calling your legislator, leaving a voicemail, there's so many ways that you can share your story if you do feel, uncomfortable going up in those rooms. And, but sharing your story, if some policy or some issue has personal meaning to you, sharing your story is just incredibly powerful. And that's what we encourage. We have relationships with pediatricians in New Mexico, and we always encourage them to go share their stories, because that has a lot of influence, because they can speak to these issues that, these inequity issues that kids in New Mexico are facing very personally. And that just leaves such an impact. And you will also see legislators come into committee hearings, and they'll bring stories from their constituents that were left on their voicemail or left, sent to them in a letter. And so, all of those different avenues still make it into the policymaking process and are incredibly useful.
And I just want to jump in there because, Derek, you got me to think about cross-generational mentoring. And we need more of that. One of the programs that I work with in Lhasa, New Mexico, actually has an annual legislative internship where we invite for a week high school students from across New Mexico to be a part of the process. So part of getting people involved, right, is getting our youth involved, letting them know that they can be a part of the process and how to navigate, even as a youth, how they can do that. So I mentioned that because I want to challenge any organization that is watching us today to consider doing some type of shadowing or in legislative internship for your own organization, because it will be so beneficial, and we can continue to create greater voices that are needed, greater involvement.
I love that challenge, Dr. Gomez Chavez, and I'm just going to add to it, or just hire the young people, right? Internships, fellowships, but also just give a job to somebody who's never had a job in this field, who doesn't have a degree yet or isn't going to get one, who hasn't been, just give them a job and teach them on the job so that we can create folks who do what we do on a full career path without having to check every one of those initial boxes and have to jump through all of those hoops before they can make a living doing it, right? So offer the fellowship, offer the internship, and also offer a paycheck.
Fabulous. Incentives are always good. Money's good. It drives people. So before we move on to implementation of policy, can you guys explain, some specific steps when working on equitable policy? What are those steps?
I will happily jump in first and say research to me is at the beginning. And another word that I think can be demystified and sort of deconstructed, that can mean data-driven surveys and polling and stuff like that. It also can mean walking down the street and talking to people, right? And so research is really, to me, engage with people in your community, in your constituency, and find out what's happening in their daily lives, and take that back and figure out if it's systemic or policy driven, right? And then definitely seek out folks at UNM or at Voices or at other organizations that do research and data-driven stuff to paint the larger picture. But I think we all know, we've all heard this before, some version of if you come across one person who's experienced this one time, then they're one of many, right? LGBTQ people did not need a survey in the 60s to determine that police brutality was an issue for queer and trans people. Like, shocking, we didn't have to do a research project. We didn't have to get grant funding. We didn't have to have a university. Like, we just knew. And today we as queer people just know that we have a hard time accessing healthcare. So start with the research phase and don't be afraid to start with that at the street level, right? An individual community, to find out from folks what's happening in their daily lives, that is probably policy driven, that's putting up barriers.
Yeah, I just cannot agree with you more, Marshall. So right now Voice is working on a research project that includes surveys and interviews, and it's focused on New Mexico's diverse refugee and immigrant communities, specifically to try to include voices from the Asian Pacific Islander and African immigrant and refugee communities. And we're going through this whole data-driven process, and we're doing these surveys and all these interviews, and of course the conclusions that we end up coming to are the ones that the community organizations that we're working with have already come to ages ago. And not to say that it's redundant, because I don't think it is. It has its place, but it is, yeah, you can just, sorry, my dog's making some noise back there, disregard her. But sorry, one second. Working from home. Okay, but I think that the perspective of people who are on the ground, who are engaged in these communities, is so valuable, and is just as meaningful as this research side of things. Essentially, this research appeals to a different population of policymakers, and some people do want to see that. Whereas, the reality is that for the most part, you can get to those same conclusions by just talking with people, by just human connection and conversation, just engaging. So yeah, I just cannot agree with you more on that.
And I agree 100%. The research is really important, and we need to honor the voices of the community. And this doesn't mean you go to people who have higher educations, right? You go to anyone in the community and listen to what the challenges are. And I'm surprised that many organizations, large organizations, kind of select, okay, I'm going to talk to this person. They're pre-selecting because they're selecting what they want to hear, right? And when you have a genuine, authentic partnership with the community, then you will be able to hear the true challenges. And, I want to caution us, right? Because sometimes we're like, oh my God, I hear there's, a specific challenge going on, and then they pre-select people. And so we have to be very careful and have open conversations and have many conversations. Because sometimes we rush things and we miss the mark. So, and then again, how do we, the development is from research to conversations, but then how do you keep people involved throughout that so that they understand that their voice mattered, that, we're listening, we're honoring them, and we're keeping them informed, because oftentimes we go and we listen and say this and that, and then we pass legislation, and then we never come back to tell them, thank you. You made this impact. This change came from what you're experiencing, and this is what we're trying to do to make it better. So we can't be thinking this is one and done. We've got to be thinking this is a process. This is systemic change. And the involvement has to continue in those relationships. And then you continue to bring those people along to other policy development opportunities as well.
Yeah, I think I of course agree with that. And these other steps in policy development include, accountability and reform. And I think it's often difficult because of politics to reform certain policies, because on some level you got to admit they're not working out as planned. But I think that that's where we need to work towards as policy people, is working towards being able to acknowledge that, hey, of course we can get it perfect the first time. Let's keep on developing this to be more equitable and to achieve that equity that we're seeking. And that does come from holding ourselves and our state accountable, because implementation, which I think we'll be getting to at some point, but the way policies are implemented are huge. And so you can't take into account all of that from the beginning. And as you go through the process, you collect more data, you end up doing more research, and then you can inform and reform better policies.
Perfect segue. But first, I love the bottom-up approach, going into the community, going to those experts that live and breathe what we want to, help them with. So they're the experts. My next question was going to be, so, we know that we go and work hard, we get policy passed, and then how do we ensure policies and bills are implemented? But you guys kind of said it already, accountability. Is there anything else that you want to add to assuring that policies are implemented through an equitable lens?
I think I would just, I think, Derek really hit it right on. We have to be willing to admit, and during this last legislative session, Representative Javier Martinez, full disclosure, is my rep and shares a fabulous last name. But, in talking about the cannabis legalization bill, he said every time he talked about it, if we don't come back to adjust this policy later, then we're messing up. We're not going to get it perfect. And just setting that framework around those conversations about hey, it's not going to be 100% perfect the first time. We have to come back. Setting up the expectation of vulnerability from the beginning was huge, right? And then it was stunning to some lawmakers. And I think some of us have been in conversations where we've heard legislators, policymakers at all levels, elected and appointed, say, well, let's not do it until we're sure we're going to get 100% right. We can't put it off forever until it's going to be perfect. And we can't ever assume it is going to be perfect, right? And I think that the only other key piece around implementation that I will say, and it's been a bit of a theme for what I've said this entire time, the people who are charged with implementing policies should also be the same experts that we engage during the research phase and that we engage during the development phase. And that means the people who live the policies. And so our Secretary of the Department of Health should be somebody who has faced a struggle in healthcare systems before, right? It should be the people who work in the Human Services Department should in fact be people who have been on SNAP or on Medicaid or on those programs that understand that have that personal connection, so that when they're implementing that policy, hopefully they haven't forgotten what those experiences were, right? What was it like to use that SNAP card at the grocery store? And how am I making sure that the people who do that today face fewer barriers than I faced when I was there?
Yeah, and I want to, as I think about implementation, oftentimes, and I'm talking in a perspective working from an educational, at an educational institution, you have people that are assigned to work on the policy and advocacy, right? And so they kind of pick and choose and say this person can be involved, but so it's kind of more like a trickle down effect. And so when the policies passed, exactly what you said, Marshall. Oftentimes, the people who have to implement those policies aren't even informed. And so it is my wish and maybe a goal to host implementation sessions after every legislative session, any educational policies, that are needing to be implemented. And I'll give you an example, like the lottery scholarship, right? There's been so many revisions to lottery scholarship. Now we have the opportunity scholarship. I mean, it's just so, but the advisors and the people on the ground haven't even been involved, right? So, but I think that the institution is trying to, to do their best, because they don't want legislators or the policy, development to be confused by many different voices, even though I believe that there's different ways, right, that we can involve. Like we just said, there could be different layers of involvement so that people are informed and are included. But for the implementation, I know that there's some organizations that do it really well, but I'm going to say some of the larger educational institutions, we need reform, Derek. We need to look at that again.
Yeah, I, of course, totally agree. And, another piece that I want to bring up about implementation is that advocacy doesn't just take place with policy making, but also with administration. Just because it's written down in policy doesn't mean that state agencies are going to follow those policies. As I've learned in this research project with Asian Pacific Islanders and African immigrants and refugees, language access is a huge issue in our communities. In the international district alone, there are over 27 different languages that are spoken, yet most of those are not accommodated for in the state. And it's required by federal law to provide language interpretation. That's part of it's Title VI of the Civil Rights Act. And those accommodations are not being met by the state, yet they're currently refusing to provide interpretation and translation services. So, part of what this current project that I'm working on is about is, holding our state agencies accountable for not providing those services that by policy, by law, they should be providing. And so, the administrative advocacy is a big piece of implementation. And, I think that because of how loosely policies can be written, there's so much room for interpretation by state agencies. And that's where advocates come in as well, is making sure that the way we believe it should be interpreted, the equitable way that it should be interpreted, is actually how it's being applied and implemented.
Wow, I could keep asking you all more and more questions, but it's 4:26 and we had a couple of questions come in that I think we should address and then move forward and call it a day. But and there's a really important, we have to come back, guys, because we need to talk about evaluation. What do you do after you've evaluated these programs, and how do you ensure that you go back to the table and fix what's not truly equitable? But that's for next conversation. So here we have a question, well, more of a comment. I like Derek's concept of who's at the table to a process. Many coalitions have said, start small with those concerned with the issue, and then keep building the membership with those you realize should be there as you move along. So more of a concept, or yeah. So, and then this one, I don't know what the QOI is, and maybe you guys know, but it says, as citizens, public employees can offer their opinions on policy issues to their legislative representatives. This can be tricky. Any suggestions to help prevent QOI? I don't know, or COI. What's COI? Sorry.
Conflict of interest.
Oh, okay. Thank you. So any suggestions?
Yeah, I mean, I think this is super tricky. So yeah, it can be super tricky, but I think it is important to know that regardless of who you work for, you have all people have the ability and the legal right to engage in the political systems around them. It's the questions are about the resources they use, the time that they use to have those conversations. If your job is working at the DMV, you can't be at the DMV office using your work computer and your work email to lobby legislators at the state, city, or national level, right? But when you go home, you have the ability, I keep saying you, we have the ability to pick up the phone and use our personal cell phone, our landline, get out an amazing stationery and handwrite a letter. Those things are available to everybody, right? And I think we've grown, I am a bit more bold and radical, and so I will say it's not accidental, but some institutions have scared their employees into believing they're not allowed to engage in political processes, and that's not true, right? And that's a part of demystifying this process. It doesn't matter who your employer is, you get to involve yourself and engage in political and policy making conversations with your elected and appointed representatives. It's just about doing it on your personal time with your personal resources.
So I'll use my own experience. As I told you, I'm very involved because on healthcare advocacy and policy development. And when I go, I do inform, because there's a process, right? We have to inform our government relations office that will be there, which that's another full conversation, because when we're talking equitable and access to taxpayers of New Mexico to go advocate, I feel like these things, as you say, Marshall, these are some tactics put in place to ensure that not as many voices become active. But anyways, so I do want to say that I do things. I send emails on my personal email. I take annual leave, but I feel it's important for me to be there because other people don't feel comfortable being there. But I have been at the university for many years, so I feel like I do have that privilege to know kind of the ins and outs and to carry that voice.
Thank you. Thank you, Derek. Thank you, Marshall. And thank you, Dr. Gomez-Chavez, for your time and your expertise today. We appreciate all of your efforts toward creating true health equity in New Mexico. And thank you to all of our attendees for joining us. Please remember to check in and check your event dashboard for more information about our upcoming sessions, including overcoming technical challenges on rural tribal communities with Ray Tafoya. So again, I'm just going to thank you all for taking time to sit with me and chat about, health equity and policy. And I appreciate your time, and you guys have a great day.
Thanks so much for having us.
Thanks, everyone. It's a pleasure.
Gracias.